Good evening. Tonight I am going to be joined by Dr. Carol Gilling-Smith from the Agora Clinic in Brighton and Hove. And we're going to be talking about fertility treatment during a second lockdown in England. Obviously, there have been lots of anxieties and feelings around this, so Dr. Carol will be giving amazing advice about the support that's available at the Agora and things to consider with treatment and everything that goes with it holistically, whilst we're tackling another wave of lockdown here in the UK. In England. And just see when she's about to arrive. I'm going to try and pin the topic on here as well so people know. Bear with me for a second. Here we go. There she is. Just waiting for it to connect and then we can start. And if you have any questions as we're talking, please do ask away. She's more than happy to answer and has a wealth of experience. So just wait for the connection to work. Good evening.
Good evening.
How are you?
I'm very well indeed.
Good. I've just been introducing yourself and a bit about what we're going to discuss tonight. But for everyone who's joining, please could you introduce yourself and the Agora Clinic, and then
Yes.
we will start talking about fertility treatment during the second lockdown.
Right. Okay. Lovely. Nice to see you. I'm Dr. Carol Gilling-Smith. I am the medical director at the Agora Clinic. I'm actually sitting in the clinic right now, and I'm the founder. This is the clinic that I founded in 2007 that opened, and I'm a consultant gynecologist. I'm a fertility expert, and yeah, really happy to answer any questions that I can help with.
Wonderful. I was just saying before you joined that if anyone has any questions as we're talking, please do ask. So obviously we've already been through a lockdown in England, around the world, but we've seen the effects of that and the sort of delays on treatment and things like that. What's been happening at the Agora and during this second wave that we're going through now?
So realistically, we'd already got quite good information from the regulators of fertility treatment, the HFEA. When COVID rates started to rise again in October, the chair of the HFEA informed all the clinics that it was extremely unlikely that the clinics would have to suspend treatment, as we had to do in the first lockdown, because in order to restart, we had all had to go through a very rigorous exercise of making sure our clinics were safe for patients, safe for our staff. And in doing that, we'd got the PPE in place. We'd made sure that we didn't have too many patients in the clinic. We'd got testing. We'd got the self-assessment questionnaire. So we had to submit all that to the HFEA to prove we were COVID. I call it COVID safe. So they said it's highly unlikely. So when the Boris Johnson announcement happened last weekend, I was on standby. We knew that there was likely to be an announcement, and it was very quickly confirmed by the HFEA that we wouldn't need to suspend treatments, provided we had enough staff, that we didn't have sickness obviously in our clinic, and that we could continue to demonstrate safe practice, which we could. So we immediately put a video out to explain that to our patients. And as far as I'm aware, all the clinics are operating normally, unless they are in an NHS centre where there may be demands on the nursing staff to go back into the NHS to support the treatment of COVID patients.
So I guess for the remaining X amount of time, what should people expect in terms of how this might affect fertility treatment whilst it's continuing?
Well, I think it's a time to be really vigilant about the possibility of getting COVID. So when I say to patients who are thinking about having treatment in the next month or 2 months, I say we haven't got the vaccine rolled out now. We do still know that COVID is in the community. We know that there are some parts of England, Wales, Scotland, they are having higher rates of COVID, particularly in the north of England, and that the chances of having COVID and even not knowing you've got it are higher. And the last thing you want is to invest all this emotional energy and buy the drugs and find yourself in a situation where suddenly you get symptoms, you're diagnosed positive, and you have to abort your treatment. So, what I'm really stressing with our patients is try to be in a very safe environment. And we tell our patients, try and self-isolate for the 2 weeks before you start treatment, and for the duration of that treatment cycle, certainly until the embryos go back. Don't get COVID. It's just going to be a real dilemma for us to know what to do. And also, COVID testing isn't that helpful, because first of all, a COVID test can be positive and you don't have it. So we have some false positives, we have false negatives. And also, if you're thinking about a cycle of treatment, we're talking 2 or 3 weeks. What are you going to test every day?
I mean, exactly. And the test takes a while to come back as well, doesn't it?
It does. So we haven't used the COVID test very much unless a patient has symptoms, in which case they immediately go to the test and trace and everything. But go by your symptoms, keep safe. And we've written letters to employers to urge employers to allow patients to not work in a patient-facing role if they can. I think the teachers are struggling a bit because obviously they're in a schools where there aren't masks or anything.
Yeah, absolutely. And so did you see a lot of anxious patients when Boris was making that announcement on that Saturday night?
Yes, it went a little bit wild. We have an Agora Friends, a closed Facebook group, and it went a bit wild with questions. So we did actually get, we used a lot of messaging. So we used our patient app to message all our patients to say that it was extremely unlikely there'd be a further suspension of fertility treatments, and that helped. And then I actually spent the Saturday evening finalizing a video, so we put that out on the Sunday morning to our website. So we had that on the website and social media, because we knew that people would immediately think this is it, we have to and even now I'm still getting questions about it. So
sure. And as you said, you've got the safety measures all there and ready, haven't you? So it's been ongoing, hasn't it, since this all started?
Yeah, and I think we are all getting a little bit tired of COVID. So, I think a lot of us sort of heaved as we sort of saw the announcement. We kind of thought it might happen. But I think we've all become very COVID savvy, and we know, whether it's patients or staff, we all know what we're doing now. We know more about this condition. And from a fertility perspective, we know an awful lot about the way it behaves. So we know that pregnancy is not, it's not contraindicated. We know that COVID is not at the moment showing any detrimental effect on early pregnancy. We know that the processes we use in IVF, for example, we do so many washes of the eggs and so many washes of the sperm that even if you did have COVID as a virus circulating and didn't know about it, it wouldn't get into the embryos. So, it's very reassuring. So there's been 6 months of quite intense science has taken place. So we're very reassured by that data, and that people can continue to have treatment with the knowledge, the full knowledge that COVID is not going to negatively impact on the cycle.
And in terms of the patients that you're seeing at the Agora, are you finding that people are anxious about continuing treatment or ready to go? Because as we said, COVID isn't going anywhere fast, and everyone's quite frankly fed up and wants to continue with their lives.
Everybody's continuing. They are fed up and they're shrugging their shoulders and say, oh yeah, how much longer? They just want to get on with it. Fertility isn't something that people really want to put on hold. If they've been waiting for treatment, they just want to get on with it. I think the only thing that some people are saying, well, do I really want to start treatment now because it's going to be Christmas? Is there going to be a Christmas? I mean, is there going to be a Christmas? It's really, they're more worried about that than they are about starting treatment. I really, honestly, people there are very few people that are delaying because of COVID.
And can you tell me a bit more about the private group that you have at the Agora for support? I think it's a Facebook group that you have, isn't it?
Yeah, we know that people need support, and there's something rather nice about sharing your stories and your emotions with other people in the same boat. And so we created Agora Friends. I think it was over a couple of years ago. We wanted to see how it worked, and do you know what it came to me one evening. I noticed that I'd spoken to some patients who said, you know what, we were in the waiting room and we really desperately wanted to reach out and talk to other people there, but we didn't feel it was right. And Agora Friends creates a safe space for people to to know, well, yes, you're going to the clinic too. You're going to the same place. We can just have a bit of a chat, and it's quite nice. It's safe. It's a safe space. We just have we monitor it as there's 2 or 3 people in the clinic that monitor, just to make sure that there's nobody posting anything, you know, that shouldn't post. But
Yeah.
it's very much a patient-led group, and it really works well. And it's been a great place for me to put messages out quickly.
Mm-hmm.
So, or Michelle, we you know, who runs the group. It does mean that if we've got something to announce, we can announce it there. I think Michelle put out that I was about to speak on this live Instagram, just to make sure that people knew about it. We put out messages during the first lockdown. I did some Q&As and put out videos. It was a great way of just reaching out to our patients in a very safe way.
Fantastic. And for people who are considering, you know, coming to you, let's say for treatment, and they might be traveling a bit, whether that's within England or further afield, how's that affecting things at the moment in terms of travel? Are you still seeing patients coming further afield?
No, I think we've not seen people traveling from other countries coming in. I don't think travel's really happening. I honestly don't think people are traveling in the same way. I think if people want to have treatment, they are focusing on that, and they're not taking holidays abroad. I mean, there are very few countries now that you can go to without having to quarantine, either to go there or to come back. So travel is not something that people are discussing.
What about within the UK though, within England? Are people still able to reach you and to have yeah, of course.
I mean, we've moved, so in order to make our environment as safe as possible, we've said, well, which parts of the treatment cycle do you not need to come to the clinic for? So it was obvious. It was all the consultations, the discussions, the preparation, the emotional support. So we moved all of our consultations with the doctors to Zoom.
Yep.
And we then found that worked very well, and moved then the nurse consultations to explain the treatment and to set the dates to Zoom. And for people who don't like Zoom, we use telephone. And then we found we could do virtual educational evenings, webinars. We could do our patient support that way. So really that halved the amount of people actually coming into the waiting room, but it also extended the reach of our care. So we found a lot of people were coming from much further afield, not just Sussex. So we're in Brighton, but we're seeing people from, you know, from much further afield, because they know they just need to come for the monitoring scans and the actual egg collection or insemination part of the treatment. And I think that we've certainly found this, and talking to my colleagues in other clinics, we think this is what patients are voting for. I think they are so much more comfortable in their own environment. I'm able to have conversations with patients where they, you know, if I'm talking to you know, a couple, a heterosexual couple, the guys don't have to take time off work, and they're coming to the appointments. They're coming to discuss perhaps why the treatment hasn't worked, because they can just take a break from work, go down, find a private area, maybe their car or somewhere private, switch on their phone, and they can be on Zoom as part of that conversation, and their partners perhaps at home or in another office.
Yeah.
And, you know, it's taken a huge stress out of the whole process for the patients, because they'd have to time it. They'd have to book time off work, half a day, travel over to the clinic, park up, come in. And now that it's done, you know, you're having half an hour conversation or 45-minute conversation in a busy day. It's not going to take a lot of that day out of you, and you feel more relaxed because you haven't got that extra stress. So I think that's going to stay. I think some patients may want to come back into the clinic, and that's fair enough. But I think a lot of patients will say, you know, this is actually really quite nice.
And I know firsthand, you know, taking those steps to make those initial calls and start testing, etc., is so daunting, as you know. So if you're removing that layer and sort of easing people in through home, I'm sure there is that kind of sense of it being a little less daunting, perhaps, to get to know everyone before treatment starts.
It is, and I think we try and make it as easy as possible. We try and fix those appointments and really help people to, you know, if they haven't used Zoom. And you know what? It's really nice because sometimes I see, solo mothers or future solo mothers, and they might be a little bit shy about coming to the clinic, or feel maybe feel very awkward about it. But I can see them from the comfort of their own home. The dogs there, the cats are there, the animals are there. There's all there. There's an environment there that they are so relaxed in that they immediately feel they can talk openly, and nobody's judging, or and all those initial inhibitions they may have had about having a conversation about their fertility. And it's often just a conversation. I just want to know what my fertility is like. And we have that conversation very comfortably. And that might lead to a discussion about treatment. It might just be, well, actually, it's great. I found out about my fertility. I've done an MOT. I've done what I wanted to do. I'm really happy. I'm content. I can go away and get on with my life and think about perhaps doing another check in a year's time.
Great. And we're going to be doing quite a lot of content together in the next few months, which is really exciting because it will give people an opportunity to learn more about the Agora and meet your team, etc. So I'm very much looking forward to sharing that with everybody too. I want to ask, I think we may have a question. I'm just having a look. No. If anyone has any questions for Carol, please ask now. And in terms of, whilst I'm waiting for anyone to ask questions, in terms of what's happening next and as we're gearing up for Christmas, are there any extra measures you're having to take, or is it just continuing in the environment you've been doing so since everything started back in March?
Yes, I think it's managing patients' expectations, because most clinics like ours do take a couple of weeks off during Christmas. And the purpose behind that is once a year, we have to do a deep clean of the laboratory, service all the equipment, and make sure that we've done a full inventory. We've done lots of audits and checks. So we tend to find that that's the best time of the year to do it. And because there are so many bank holidays over that 2-week period. So most clinics will stop we'll stop treatment cycles during that period. So we're just now trying to make sure people aren't disappointed. We're going to start, the last cycle dates, the start will be around the beginning of December. And then a lot of the advice I give in that lead up to Christmas is about drinking and, whether that's safe, lifestyle. And that really is, if you're on a fertility program, I do think that Christmas is a terribly important time to feel relaxed and to be with your loved ones, to do the things that you want to do. And you know what, a drop of wine here or there, or a bit of alcohol here and there, is absolutely fine if it helps you relax, as long as you don't get into a habit of doing, lots of heavy drinking, lots of heavy nights. And I think particularly if we don't have the sort of party scene that we normally have, it can be a little bit easier.
Exactly, no Christmas work parties or things like that.
Yes.
Someone has just asked, Sarah has asked, do you think that intralipid infusions work for women with high natural killer cells?
Oh, this is a long, it's a long question and a long answer, because the reality about natural killer cells is that we have got a very difficult, it's a very difficult question to answer, because the levels of natural killer cells that we find in the womb lining and in the blood are different. So the testing is not good. And because the testing isn't reliable, and there are many different ways of testing, we have this controversy when we look at the studies, the scientific studies that have looked at natural killer cells and implantation in IVF. You don't find a consistent answer. You don't find a nice black and white, yes, if you've got elevated killer cells, you are definitely going to benefit from intralipid. And I'm very honest with my patients. I think the real problem with natural killer cells is they do exist, and I'm sure the immune system is implicated in a small proportion of women who have repeated failed IVF cycles. But I don't think the test that we've got at the moment is good enough. So the studies don't give you a conclusive answer because the test isn't good enough. And when somebody says to me, what if I do a natural killer cell test? I say, well, it may well be positive. It seems to be positive in a lot of patients, but is it a real positive? And I don't know. And I think that's the problem. As a scientist and as a clinician, I really don't always know. I think, however, there are some patients where we've exhausted all the other possibilities. We just don't know where we're going. We've put some beautiful embryos back. We don't know why the embryos are not taking. So some of these more experimental things that we're doing, measuring activity of natural killer cells are obviously ways that patients want to go because they don't want another cycle to fail. So I do understand that need to have that test, but I would ask patients to be cautious about the interpretation. It's very difficult, and you know, the HFEA website is so clear about this. It's not an add-on that's been properly verified and properly shown in studies to be beneficial. So when we do intralipid, we do it almost as, well, it should be experimental. I mean, try it. You're the experiment, try it. And, you know, if it works, it works. We've been very cautious during the COVID pandemic not to give patients any suppressant.
About that.
Yes,
yeah, exactly.
And it's certainly a directive from the HFEA that we shouldn't be using anything to suppress the immune system. However, again, after consultation with my clinical colleagues up and down the country, we do feel that if somebody is fit and healthy, they don't have any risk factors, particularly for COVID, in terms of, you know, the chest, you know, chest disease, not overweight, young, they can make an informed choice and they can take some suppression in steroids and intralipid, as long as they understand, number one, it's not ideal to be doing that during a pandemic, and yes, number two, the scientific literature is inconclusive about the benefit of this add-on.
Okay, thank you for your honesty, because it can end up being expensive, can't it? And also, yeah, you know, making you question the results. Yeah. So there have been some other questions which are about lots of different topics. One lady had asked about speaking to you about her personal treatment plan. So if that is the case, please do feel free to message the Agora directly or message me and I can put you in touch. That's no problem at all. And then there was also a question I just saw, and I'm sorry, I'm just trying to keep up with them, about...
I saw one about PCOS and inofolic.
Yes.
So inofolic, yes, I'm a big PCOS sort of, I did my PhD on this. So inofolic is a vitamin, it's a folic acid supplement which contains another supplement, myo-inositol, which is thought to be deficient in patients with polycystic ovaries. And there have been some studies, particularly coming out of Italy, that have looked at the potential benefit of this supplement in women trying to conceive, both in helping with cycle regularity, improving the chances of ovulation, improving weight loss in overweight women with polycystic ovaries, and in reducing the risk of getting diabetes during pregnancy if you conceive. So I generally recommend it in my patients with polycystic ovaries as the best folic acid supplement.
Okay. That's good to know. Thank you very much. And we'll take one more question. What's the cause of thick endometrium in some areas? Will that affect implantation and embryos?
That's a very, very wide question.
Yeah.
I'm not using a pun there, because a thick endometrium, it depends where in the cycle it's thick. So when we're talking about IVF, if we see an over thickened endometrium, you know, 16, 17, 18 millimeters at the point of collecting the eggs, it's too thick. It's worrying us a little bit that something in the development of the lining has gone wrong, and it's difficult to decide where it is. If it's patchy, it could represent a fold of the endometrium or a small polyp, in which case implantation would be improved by having a hysteroscopy, something that is it's a little telescope that's put in through the neck of the womb under anesthetic to look inside the womb cavity and to be able to distinguish whereabouts you might have irregular lining or thickened lining or a polyp, and remove the polyp and create a better lining. But otherwise, it can be a reaction to the high estrogen levels as a result of the ovarian stimulation process. So when you take lots of fertility drugs, it can induce so much estrogen that you get an abnormal development of the womb lining. I always call it overcooked. It's an easier way of explaining it. And we know that implantation is less good or less likely to happen in such a situation. So we have got situations like this where we would electively freeze the embryo. We would electrophoresis the embryos, and certainly in our clinic, we're seeing very high frozen embryo transfer cycle rates, and particularly in those cases where the lining is a bit thickened. And we actually advise patients to freeze their embryos, let everything calm down, and then come back in a natural cycle where you don't have these excessively high levels of estrogen.
Because people do, I'm sure, often ask you what the success rate is from, between fresh transfer and a frozen transfer.
Right now at the Agora Clinic, our frozen transfer cycle rates are quite a bit higher than our fresh transfer cycle rates. And it was actually interesting. And my colleague, George Gustas, who's the director of embryology here, and I were talking about, particularly in young women, we were wondering whether the COVID stress had anything to do with it, and whether subconsciously there was an impact of COVID on success rates in fresh cycles, because we were just looking at our success rates sort of coming out of lockdown, particularly in young patients where you'd expect really, quite the highest of success rates. Yeah. And we use that really as our control group. That's where your best success rate should be. And we've certainly seen pregnancy rates improve, but we just felt there's this 3 months or 2.5 months of shutdown may have been so stressful for some patients, it may have impacted success rates. We're seeing a more normalized pattern of success rates across all age groups, but despite beautiful embryos being made, we noticed it wasn't like a massive drop, but it was just a bit less than we'd expect for the younger age group.
That's really interesting. And you provide incredible holistic care, don't you, at the Agora, in terms of counselling and other kinds of support. So do you feel people are taking advantage of those things during an even more stressful time at the moment?
I hope so. We definitely want patients to do things for themselves, and I think everybody finds something that helps them to find what you want to be is in control. And unfortunately, when you go to a clinic, some patients will inevitably feel the clinic's in control, and I'm just coming through, and I'm helpless. I'm at the mercy of the doctors and the scan results and everything. So trying to do something outside that helps you to feel more relaxed and in control it's definitely something I recommend. During lockdown, we were really fortunate. Alex Oles, who does fertility massage, did these wonderful meditation baths on Zoom, and our patients just loved it. And that was just a way of using that lockdown period to try and get everybody's calm hormones really to help them. But we do, acupuncture. I encourage all these things, and I also encourage talking, because talking to our counselors or just talking to us can make you feel more reassured.
Absolutely. I think that's great advice. Thank you very much. There have been some other medical questions coming in. I don't know how you're doing for time, but
okay. How common is having a uterine septum? Well, a uterine septum is a little bit of an unusual situation, but it arrives because the uterus is created during your development in your mum's womb. You have two tubes and they fuse together to form the uterus, and so sometimes you find that the fusion isn't complete, and that you have this line that separates the uterus into two. Usually a septum isn't a problem in terms of implantation because the embryo finds its way. But if the septum is very thick, there have been some studies looking at how thick it should be, but there are some studies that show if it's very thick, it's better to be resected. It can be cut back in the hysteroscopy procedure, that keyhole procedure that I explained before. A little camera goes into the womb to remove it.
Great, thank you. Another question, would you recommend having an endometrial scratch for the first round of IVF?
No, I don't think so. I don't think there's enough evidence to suggest that it's going to be beneficial at all.
Thank you. And improving egg quality at 44?
The evidence for DHEA is, again, very limited. It had given us a bit of hope about 10 years ago, but after a while, we started realizing that DHEA can have a negative impact on the womb. So, the hormone, it's a male hormone, can actually make the womb less receptive. So I don't advise that. Coenzyme Q and all these, and ubiquinol, I think the jury's out on that. but it's not harmful. So probably in somebody of 44, I'd say that's not a bad route to take, but there isn't anything else. There's no magic pill or drug to take that we know of.
And at the Agora, what do you normally recommend in terms of how many embryos a patient has transferred?
Well, certainly under the age of 40, we know that it would be unwise to transfer more than one embryo, particularly as we transfer most of our embryos on day 5 at blastocyst stage. And the only exception would be if somebody had had, 2 cycles that had failed, or embryo quality was very poor and we were on day 3. Over the age of 40, we do it on a case-by-case basis because as women get older, they have more genetic errors in their eggs, and that can impact on the chance of the embryo being healthy, genetically healthy. And you need a genetically healthy or normal embryo to conceive. So more and more over the age of 40, we consider replacing 2 embryos. But it is after really looking at the individual and the risks.
Of course, yeah, that makes complete sense. Thank you. Well, thank you very much for tonight and for answering all of these questions and also for updating us in terms of the COVID situation. If anyone would like to get in touch with Carol, then please either message myself or message the Agora directly. And as I mentioned, we have a lot of excellent content coming up together. So please do keep following, and no doubt it will be extremely helpful.
Yes, that's fine. I can see lots of other questions. If you want to just send those questions to the Agora, we'll try and get some answers for you over the next 2 or 3 days. But sorry, we've not been able to answer them all tonight.
Thank you very much.
All right then, thanks.
Thanks
Bye.
everyone for joining. Bye-bye. Bye.